Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan.
I'm Joe Steckler. Welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County, a show designed to provide you with information on how to develop your own aging and care plans. Our topic today is headaches, and with me in the studio is Dr. Lee Sheldon of Solid Bite Dental Implants.
Hi, Joe.
Hi. You know, you might be wondering, as I did a long time ago, what in the world a dentist has to do with headaches. And it's not only headaches, and on almost every show I've held up a copy of Dr. Sheldon's book, The Ultimate Mouth Manual. And I'm telling you, he's writing another book because you learned that there were a lot of things you talk about in this first book that just lay people needed to understand in lay terms.
You're absolutely right.
And I was amazed, Lee, to find out that there's quite a discussion in your book about headaches, the cause for headaches, migraines, treatments for migraines, what we might do to prevent headaches in the first place.
Yeah.
And so it was a topic that caused me several months ago to say, let's do a radio show on headaches. And you said yes. So then in the process of doing this new series of television shows, I said, I think we ought to put this in our next television series because so many people have headaches, and me included, because of the medical problems I have now, I was more prone to develop headaches.
Yeah.
And the type of headaches I developed caused me, when I got out in the light, to really not be able to see that clearly because it was a blinding light. And I noticed that the pain radiated back up into my head, back into my shoulder area. So I thought, this is a good topic to talk about because the average person gets a headache and they take an aspirin or they take an Aleve or an Advil or something like that, which I think are statins, aren't they?
No, they're not statin drugs, but boy, do they do damage, particularly if you're taking them every day or every other day.
Okay, we'll talk about that in a minute because that's something you get me off this topic and we start talking about other areas, and
we'll talk about over-medication for headaches.
Yeah, well, I'm not. Yeah, well, we're going to talk about medication, then we'll talk about Aleve and some of these things.
Okay.
But first of all,
yeah,
let's try to follow the script for today.
Yeah.
What is a tension headache?
Well, tension headache is simply a contraction of the muscles in your head. You've got muscles here. They contract. So the nerves are firing, the muscles are squeezing, and you say, ouch. That's basically a muscle tension headache.
I said tension headache.
Yeah.
How does stress affect it?
I think stress can affect anything. In other words, if you're already in a weakened condition and then something is chronically bothering you, that's going to make that weakened condition worse. Just before I got to the studio today, I saw one of my headache patients. She's in her early 30s and she has headaches, and we're treating them, and she's done very well. But she also said when she goes into work and encounters one or two of the staff members who happen to work at her place of business, her headaches get worse.
My wife said that my doing 30 television shows in 5 days was a subject for stress, and it caused my back to hurt. It probably could.
They probably could.
It probably could.
Yeah, because you're holding a certain posture, and so certain things are working that may not be working the way they ordinarily would.
You should have mentioned posture because what I need to do is sit up straighter.
Sit up straight.
I forgot my back brace.
Squeeze
today.
those butt muscles.
Well, I am squeezing those
right,
muscles, but I forgot my brace today, so now I have to sit up on my own. But it causes tension in my body.
Yeah.
Any place that causes tension in my body, it radiates up through my hip into my neck area.
You remember the old song, the knee bone's connected to the thigh bone's connected to the hip bone.
I remember that. Now look, you can be a cantor at Temple Best Shalom, but you're not going to sing on this show. That's the last thing you're going to do.
I think I just did, Joe. I got away with it.
I know. No, you're not going to get away with it. Let's get on to the subject of hypertension. One of the questions I had, I said to myself, and I said to you when I sent the show to you, I said, if I have hypertension, is that a cause for headache?
No.
Why not?
Well, if you have hypertension, it means that your heart is squeezing and your blood vessels are holding a higher pressure of fluid, blood, through them. That doesn't necessarily translate into headaches. If a person, now that doesn't mean a person who has hypertension or has a hypertensive episode couldn't have a headache, but just because you have hypertension doesn't mean you have a headache.
So that's like a myth.
That's a qualified no.
It's a qualified no.
It still could be a yes, but it's a qualified no.
Okay. I have sinus headaches, but my sinuses are clear. How can that be?
Because you don't have sinus headaches.
Why not?
You feel there's sinus headaches. You've got this pain under your eyes.
Right.
You've got this pain in your temples. You have this pain right here, and you call it a sinus headache because that's where your sinus is located, right?
Right.
If you look at a book that was written in 1948 by Dr. Janet Travell, and Dr. Travell was John F. Kennedy's physician,
yep.
She mapped trigger points.
I was going to ask about that. You're way ahead of me.
But you asked me the question. I'm going to go ahead.
Okay, go ahead and answer.
How often do I go by your script anyway?
I never get to follow my
That's
script.
right. Absolutely right. So if you happen to have a trigger point in your neck, and that trigger point starts to fire, you're going to feel pain here, you're going to feel pain here, and you're going to feel pain here. You think it's the sinus, but it's coming from the neck.
Why is it coming from your neck?
Well, that's how trigger points act. A trigger point means that a trigger occurs which sets off a reaction in other parts of the body. In other words, just because you have a neck trigger doesn't mean you're only going to feel pain in the neck. That consistently, if you have a problem here, you will have a problem here, here, and here. That's how a trigger point works.
What are the main trigger points?
I found that, particularly in my practice, which is primarily a TMJ in headache practice, that one of the most common...
Wait a minute. Okay, you mentioned that TMJ is now called TMD, right?
TMJ, yeah, and there are a number of different...
yeah, but the old thinking was TMJ. But I'll let you get away with it.
The reason it's called TMJ is because people say I have TMJ. TMJ means temporomandibular joint. Okay, so, all right, I have temporomandibular joint. You have a temporomandibular joint. We all have temporomandibular joints.
Whereas
it's like I have elbow or I have hip, I have temporomandibular joint. It doesn't make any sense. So they call the TMD temporomandibular dysfunction. Now they've got dentosensorimotor dysfunction, DSD. I mean, there's all sorts of different names for it.
What is the significance of it? Why was it so important that President Kennedy's physician discovered his trigger points? Why is it important, Lee?
Well, I think the fact is that if we're getting these pains, it opens the door to a solution. Example, I have a headache practice. Patients, primarily I'm a periodontist and I do dental implants and big reconstructive cases. That's what I do. But I have a separate area which is a headache practice. And what we do for our headache patients is identify the trigger points and settle those trigger points down. For example, you brought up the fact that or at least we got to the point of trigger points. If I'm able to help a person neutralize trigger points using things like physical therapy devices like ultrasound and microcurrent and cold laser therapy, things that we can do to relax those, yeah. Well, if we're able to do that and the headache goes away, well, the patient now has found a source of relief. When Dr. Travell was doing this in 1948, and we still do this today, if a patient had chronic pain, you could inject a small amount of local anesthetic, sometimes a small amount of a steroid, into that trigger point and get that trigger point to stop firing, and the patient's pain would go away.
Can that type of a trigger point be treated such a way without medication? We talked on several different television shows about in not using medication and trying to get to the source of the problem causing the pain.
Yeah, yeah.
In the case of trigger points that trigger headaches, I've not asked a question, but like you said, you had a patient this morning.
Yeah.
In your diagnosis and your treatment, do you try to get to points, or can you get to some place that helps stop the original cause?
Absolutely.
How do you do that?
Yeah, the first thing you need to do is look at the patient's function right now. So if we're talking about a headache patient, we're talking about the upper part of the body, we want to know, how far does the head move this way? How far does the head move this way? How far does the head move this way? How much restriction is there? So that gives us an idea as to what's going on in the neck. We also have a device which, we measure how far the patient can open. And there's a certain number of millimeters that a person should be able to open. Average is about 45 millimeters. If the patient is restricted in opening, that gives us one more piece of information. The third thing is actually a muscle palpation examination. Essentially, muscle palpation.
Muscle palpation, okay.
Essentially, I'll push in the areas of the musculature that control the headaches. And we see whether you have pain in those areas or cause the headaches. And I'll see whether you have pain and how much pain you have in each of those individual areas. One of the key points of therapy is then to apply physical therapy modalities to each of these areas, which takes about an hour with one of my staff members, and then we see if your headache has gotten better, or we see whether your range of motion has increased. If so, we know we're on the right track. Now, what's interesting about this whole thing, Joe, is that all of these muscles are innervated. They all have nerves.
Right.
And they have motor innervation, and that's what causes something to work, causes the muscles to contract so I can move my hands the way I'm doing now, or move my arms the way I'm doing now. And there's a sensory division. And the sensory division is the key, because if they're highly sensitized, you're going to have a headache. If we can neutralize the sensory portion of that, then the patient will do better. It's interesting that the muscles of the head, the neck, and the nerves that are around the teeth all communicate into the same area, the same general area called the trigeminal nucleus.
I did learn that.
Good.
I learned that.
So in fact, when we bite down, and if our teeth aren't meeting correctly, and our jaws are going off to the side because the jaws don't really want to be where the teeth are guiding the jaws into,
And then gets TMJ.
That becomes a TMJ problem,
Okay.
which can become a cervical problem. So essentially what we need to do is get the entire system in tune. We have to get the muscles relaxed. We sometimes and often put an appliance, something that fits over the teeth, which will allow the jaw to go into its most neutral position. And once we have all the symptoms quieted down, we can literally do some adjustments in the teeth. A little bit of grinding in the teeth. I know that sounds bad, but we're really not doing a lot of adjustment in order to make sure that the teeth meet the way the jaws want to meet, and then we can get the patient comfortable relatively permanently.
Okay, but look, like me, right now, I still have to get the bridge on this side from the 3 implants, which you have pronounced safe for me to get my bridge put on.
Yes.
But my bite doesn't feel right.
Okay.
And you had recommended that I get that thing that fits over my upper teeth that I wear at night. I do that.
Correct.
And I know for a fact that over the last couple of years, I could it happened a lot on Sunday morning after I came out of church. And I went to Bible study, and then we were going to go to breakfast, and I get these horrible headaches. And the light was just piercing when I come out of church. Since over the last month and a half that I've been wearing that thing at night, I haven't really noticed a lot of headaches.
Okay. So let's go back to what we talked about. The light is a trigger point for an already existing problem. So now you've neutralized the already existing problem by having something, an appliance, a piece of plastic placed between your upper and lower jaw. So now the muscles are more relaxed. Now the light doesn't have much to trigger anymore. Now the final solution to that problem, if you could get there with your dentist, would be, now that you're relaxed here, would be to get your bite adjusted so the teeth are even before you have your final bridge work done. so that their bite doesn't become a new trigger point or a new trigger for headaches later on.
In my case now, but I still haven't had the mold made for these teeth over here.
Yeah.
Before.
Yeah.
Would it be best for the dentist to adjust my teeth now?
Yes.
Before for the bridges?
Yes. If your muscles are totally relaxed, yes. If your muscles aren't totally relaxed, no.
How do you know if your muscles are totally relaxed?
It'll be my pleasure to palpate your muscles and find out.
Here I go again. Every time I open my mouth, folks, I end up back in his office in a chair.
Yeah, how do you like that?
Yeah. Well, he's got nice assistants. So
Yes, I do.
Yes, you do.
I have the best.
Yes, I have to agree that you've got. Well, I know some other dentists that have some pretty good ladies that clean teeth and do things like that too. So I'm not, but
I have the best.
Well, okay, you say you have the best, but I'm serious, and I didn't realize it because when I bite down, it feels like this tooth here is hitting the back of these teeth first.
Yeah. And that's the whole example. So now your jaw may be forced into a position by the teeth that it really doesn't want to go into.
And then what I do, but then what I do is I start,
yeah.
it's uncomfortable, and I clench my teeth, and that then works on this muscle up here.
Sure it does.
And then that causes a headache.
Yeah. You made up the diagnosis. How about if I interview you? You're doing better than I am.
But I'm serious, and but it is described in your book.
Yes, it is.
And it is described, Lee, in a way that I can understand it. I'm sure you have books for our camera crew, and I'm sure that when we film our second series of shows, they'll all agree, if we put them in front of the camera, that they learned something from the book.
Thanks. So you can get a copy of the book too. So
yeah, okay.
By all means.
But okay. But the follow-on to words, inevitably in all discussions we have about headaches, the word migraine comes up.
It does.
And migraine is, and I've known people and know people that have what has been diagnosed as a migraine headache, and I see how sick it does make some people. They have to get into a room where there's no light, no noise, and they either take or do not take their medication, but there are a lot of medications that people that suffer migraine headaches. Of course, now, every time I talk about that, the old bug comes back to me that maybe if they would have had the thing around their teeth, or there's some other things they can do, that they wouldn't have this.
Essentially, when they're taking medications, all they're doing is taking medication, which is dulling the pain.
That's
Again,
right.
we've talked
It's
on
not
other
gonna
shows
go
about
away.
the source of the problem.
It's not going away.
And just because something has been looked at or is diagnosed as a migraine headache doesn't necessarily mean there aren't muscular triggers which, if neutralized, the patient couldn't get better. We have patients who are migraine patients in our office who are doing better simply as a result of the therapies that we do. So just because you've been diagnosed with a migraine does not necessarily mean you have to stab yourself with a medication in order to relieve yourself of the migraine headache. You may need to do that for a short period of time, but you don't want to take that kind of medication for a long time either. Get to the diagnosis, and if it is a muscular problem, get to somebody who's qualified to get those trigger points relaxed and relieved, and you may be a former migraine patient as a result.
You're a dentist.
Yeah.
But in the years that I've known you, you delve into other areas of medicine too. You really do. But a big problem I have, Lee, is that there are so many medical problems that exist that are very serious, that the degree of seriousness could be lessened if people only knew where to go.
That's right.
And that's a big problem. And I was thinking about, night before last, after I finished doing some of the television shows, I was thinking about when I was a young man that I went to the dentist, had cavities filled, and they put Novocaine in the jaw and did a job. I had some illnesses as I grew up. I had an appendicitis, but I played football. I have a question I want to ask you about a football exercise. But we didn't go to the doctor that much. And I got hammered around quite a bit, but if we'd have broken a bone, or one time I fell on some logs I was walking on and cut my hand all to pieces, and I had to go to the doctor and get it all sewn up.
Sure.
But we didn't go to the doctor very much.
No.
We just didn't do that.
Yeah.
You brought up something when you were talking about your head going like this.
Sure.
One of the football exercises you did, warm-up exercise, when you're standing there, you put your head up like that, and you're doing like this, then you roll your neck around. Was that a good exercise?
Yeah, it was.
It was a good
There's some
exercise?
question as to whether it's a good idea to roll back, particularly if you already have a problem. But certainly rolling forward is good. Certainly going to the side is good. Just grabbing your head and moving to the side and trying to increase that range of motion is good, and you can do it just that way.
Yeah. My primary care doctor, in one of my sessions with him, he was talking about how he would move his head to increase the range of motion.
That's what we're doing. We happen to do in our office by relaxing the muscles first and then measuring how much the patient can turn. But certainly those headaches can be headaches. Those treatments or those home physical therapy exercises can be done, and they should be done, because we tend to stiffen up as we get older, and those muscles aren't moving nearly as much as they should. And if you talk to some exercise physiologists, they will say stretching is as important as muscle strengthening, and so both need to be done. And frankly, there's some very simple exercises that one can do in order to make sure the head is moving in the correct direction.
Is that stretching and turning a head like that?
Yeah, three very simple ones. Okay, so, and I'll only do it on one side. One is the one that I already did. And hold that for a count of about 20 seconds. And then let it go up. The other is turn your head and to assist your head. Don't make it painful, but just assist your head to one side and the other. And again, hold it for about 20 seconds and then relax. And the third one is muscle contraction, or cervical contraction and cervical extension. If you can get those muscles working well. I remember I had a patient years ago whose son was a chiropractor, and she was getting headaches. And I got her on the exercises, and he wrote me a nice letter saying, "Thanks for helping my mom." Now, he happened to be in another state, so we didn't have the opportunity of treating the mom, but her headaches got better.
Well, we are going to, and another thing, I would suspect that a dentist and some other medical people that work in a position where they're bent at certain angles and they got their arms, and you stand up all day, you get a deep massage.
Oh, I do, once a week.
Once a week.
I do.
But with the subject of headaches, how would a deep massage, what effect would that have on a person who is suffering headaches?
I think we're looking in the same area, trigger points. When Chris is doing my work, and Chris is fantastic, he's actually finding those trigger points and is putting his thumb or his elbow, I can't see what he's doing, right into those areas to neutralize it. And so he's doing the same thing that we're describing here. This Dr. Janet Travell was a very, very important physician, and she.
What kind of a doctor was she? Do you remember?
I don't really know. I don't know what her specialty was, but physical therapists all know her name. Massage therapists all know her name because of the importance of the work that she did.
Well, I know that I have, in the process of treating my back pain, I do know that if I ignore my exercise or my therapy, I am prone to get stiff in my neck area, and I do get headaches if I don't exercise. And sometimes when, there's so many different thoughts on types of exercise programs, but you mentioned something I think is key, and I'm learning this more as I get older, that stretching is extremely important. And I can see now the importance of stretching the neck. That's one part of my exercise regimen that I have ignored, but I intend to put that into my exercise regimen, the stretching of the neck, and because I think it's extremely good. I do a lot of things that try to stress flexibility of the legs, the waist, the body, and tension in the stomach. Good. Because if you have a back problem, one of the things that they teach you when you if you do home therapy, well, I did home therapy after my hip exercise. When you're laying on your back, it's just to squeeze your buttocks to those muscles in the buttocks move up into the lower lumbar back.
That's right.
There's a lot that we can do ourselves to control so many things that go wrong with us, but we need to be better informed on what we can do to help solve those problems.
I want to hit one area. We just have a short period, and it's an area I should have hit earlier, but let's hit it now. If you broke your arm, what would you do? You'd go to the hospital, you go to the orthopedic surgeon, you put a cast on the arm, and you get things monitored, and then you have physical therapy when you get all done to get that arm working well.
Right.
What happens when we have an auto accident?
Well, you hope you come through it.
Yeah, we might go to the emergency room, an x-ray is taken, there's no damage, and we're given a collar, and nothing happens. Well, shouldn't we be treating this area the same way as we treat this area? Shouldn't we be going through physical therapy? Because I can tell you what happens in a whiplash accident, and all you have to do is be hit by a car at 7 miles an hour. It doesn't have to be much. There is going to be damage that occurs here, scar tissue that forms here, and it's never going to be exactly the same as it was before that accident. It's important that those areas be developed. So if you've had a car accident and you've had this kind of a problem, a whiplash problem, where you may not even know there was a whiplash problem, this could be a source of your headache too. And all we have to do, and it sounds simple, but all we have to do is reverse that problem through proper therapy, and you could be better again.
Many people don't realize the involvement and the extent of involvement of a dentist in treatment of injuries and things. When I was a submarine officer, I was executive officer of a submarine tender. One of my dentists on there was the foremost operating guy on facial injuries and battle casualties. If a chunk of head was there or facial damage, this dentist was one of the leading reconstruction persons in the United States for fixing the face. Yeah. So dentists do a lot more than we think they do.
Yeah, they do.
We have a minute. What would you say about headaches, our topic today? What should people do?
I think quickly, if you are taking medications on a regular basis for headaches, those medications will do damage to your liver and to your kidneys. Yep. And that means if you're taking any of the over-the-counter medications, that's what's going to happen. Stop. Get it diagnosed. Get it figured out.
Thank you, Lee.
You're welcome. Thank you, John.
Pay attention to your body, folks. And thank you for watching today's episode of Focus on Seniors. If you have questions or comments, please call radio station WMEL 1300 AM at 321-631-1300. For more information on senior care and resources, visit our website, helpingseniorsofbrevard.com. Thank you for watching, and I hope you learned something.